welcome to Women's Health. This segment is going to be concentrated on the elderly, and specifically elderly during COVID and after. And we will probably try to talk about a lot of variety of things related to the elderly and their health, but specifically a little bit about mental health. My name is Kathy Ermacher. I am the president of the Women's Foundation and the chair of the Commission on Women and Gender. These programs are provided funding by Women's Foundation of Lincoln and Lancaster County. I'd like to welcome my guests today, Dr. Stacy Waldron and Jean Holt. I'm going to have them introduce themselves and tell you briefly who they are. Dr. Waldron.
Hello, my name is Dr. Stacy Waldron, and I'm a licensed psychologist and the Psychology and Therapy Staff Supervisor at Bryan Counseling Center. I've been a licensed psychologist for more years than I'd like to count, and I have been at Bryan for just about 7 years now. So that's who I am.
And Jean?
My name is Jean Holt. I work at Aging Partners. I'm a social worker. I have been here for 31 years. And the area that I work in, we're the social workers that come down and sit at your kitchen table and talk about what to do next when you're trying to make big decisions about your life as you age.
Okay, fantastic. Well, welcome and thank you both so much for joining us. In the last vital statistics that were published in Lincoln, we saw that the largest growing population in Lincoln in the last 10 years is, in fact, the group that is 20 or 65 years or older. So our elderly population in Lincoln is actually growing at a faster rate than some of the other age groups in our city. And we know how vital the elderly are to our community in lots of ways. But today we're going to talk about some of their concerns and challenges. First of all, we're going to talk a little bit about the COVID and what that meant to the elderly. What were some of the things that you saw in your practices and in your work that were effects, serious effects, obviously, more than some of the other age groups that happened to the elderly during our COVID times? Jean, do you want to start?
The isolation of older adults really took its toll. We were all isolated. We all were confined, but so many caregivers that were already very limited in their social contacts were completely isolated and left alone. Family members that would take care of their loved ones, those that worked in the healthcare industry, were particularly kept away from their older adults just to keep them safe and healthy. They really took a decline in taking care of routine health, like getting a mammogram or going to the dermatologist for a skin check, foot care. Those types of things really took a back seat as people tried to stay home and be safe. There's a financial impact that it really affected the older people in a way that did not affect the rest of society.
Right. Those things really make a lot of sense. Dr. Waldron, what would you say?
I think in addition to that isolation, which was significant, I also think there was a fear. When we first started learning about COVID, we learned that one of the big risk factors was age. So the people who were 65 and older were thinking, I'm at higher risk than, say, that 18 or 22-year-old. Those people thought they were invincible to begin with, but then they weren't one of the people that were in that group that were at risk. But the 65-year-olds, they were very scared that if I go out, if I go to the grocery store, if I go to see a friend, if I go and have a cup of coffee, I'm going to get COVID. And so that was terribly frightening for the longest period of time. They wouldn't even go and have lunch with someone. And we literally came up with ways in which they could see a friend or see a loved one, finding that they could eat at opposite ends of a picnic table or something like that, just so that they could see people and get out of their houses, because that isolation that Jean was talking about was becoming very detrimental to their mental health over time. When they thought it was a couple of months, it was fine. But as we were going into month after month after month and in a year, it was becoming very, very significant.
Did you see an uptick a lot in mental health concerns with the elderly?
I saw an increase in depression and anxiety. I saw people not wanting to take care of some of those things either. They didn't even want to come to the doctor. So one of the benefits that came very quickly was when we had the ability to do telehealth. Once we had the ability to do telehealth, we could start treating those people. And once Medicare started allowing telehealth, and it gave the comfort to that population that we could start seeing them. They could also start seeing some of those other doctors again that they were afraid to go to, because telehealth wasn't just for mental health. They could do it across the board for all of their practitioners. Telehealth was broadened, not just the type of Zoom that we were doing, but they could even talk to someone on the telephone and renew medications, things like that, things they weren't doing, which was very important.
Yeah, that makes sense. And Jean, I know that Aging Partners has a lot of opportunities for elderly to come together and to connect with each other, whether it be at the centers or various other places. What changes did you have to make with Aging Partners to be able to accommodate some of those things when the COVID was kind of in the heat of it?
Well, we could not have our senior centers open. So our senior center managers took food to participants every single day. And it was a major undertaking, but at least it gave our clients face-to-face contact with someone. Of course, the managers all wore masks and gloves and didn't approach the person, but it was still nice just to see another person every day. The care managers, when we would have to see clients, we stayed in the driveway and we all brought along a card table and lawn chairs and sat outside as long as weather allowed for it and met with people that way. Our health and fitness area continued to have classes on Zoom and the televised programs for Tai Chi and yoga and things like that. So we really did our very best to stay connected with people.
That's fantastic. Do the elderly in general have I know you're talking about telehealth and we're talking about the Zoom and everything. Do most of the elderly that you see or work with have computer access? Do they have those kinds of skills? Were they able to get to a computer screen to be able to do these things?
Not everyone. Most definitely not everyone. We all have a smartphone, but if you're older, you can't see it. And I get frustrated with my smartphone and I want to throw the darn thing away. And so it was, people were depressed, anxious, and then having to deal with technology on top of it all was often just more than someone could handle.
Mm-hmm. Yeah, I noticed that too. We have some people that we work with in this category, and some of them were computer savvy, but a lot of them were not. And so they had a big learning curve in trying to do some of these things that the rest of us thought were okay and easy to do. Some of them found that challenging. Are there services that get computers to the elderly if they do not have them? Do we know about that?
Mm-mm. Not that I'm aware
Yeah.
of.
We'll have to do some research into that and see.
I think the biggest thing is the smartphone, and there were access services, especially during the height of the pandemic, to get smartphones to people, to low-income people, people who couldn't afford them otherwise. Internet services as well were being spread out. I don't know that those services are still being open as much as they were when schools were on all remote. Those were available to both school-age children and low-income families, where they were providing smartphones and they were providing internet service. I think that's been scaled back some. That was part of the CARES funding, where you were able to get some of that, those things available, but I think that's been scaled back at this point. So the people that got those things had those resources, and I don't know that they have that as much these days.
That's a real problem too for people in rural areas that don't have Wi-Fi at their home and can't afford it. They're very, very isolated in the rural communities and farms.
Yeah, that's a really good point. And I think that COVID really brought some of those issues like that too light. And specifically when it was talking about children needing to get educational services, but the elderly were also a part of that, needing to have those services. Regarding physical health, what do we think about the status of the elderly in Lincoln as a whole? And then also, not necessarily specifically related to COVID, but is physical health a contributing factor to how well the elderly do?
Absolutely. I think a lot of people can look back at their friends and older relatives and say everything was fine until she fell. And that's kind of the turning point. She was never the same after that big fall. So during the pandemic, people lost a lot of mobility and they lost a lot of strength because they weren't exercising. And that puts everyone at much greater risk for falls. So we've really taken on fall prevention classes through our health and fitness departments to try to keep people to regain what they've lost. We have personal trainers available that work with our people that are over 60 and older. We've got Tai Chi for arthritis and fall prevention and a stepping on program to work with balance. That's really where our real strong focus is right now.
That's excellent.
But you've got to encourage the people to go back to those group classes. Silver Sneakers used to be a great group class that people wanted to attend. Now they're somewhat afraid. Do I want to go back to my water aerobics class? Do I want to go back to my Silver Sneakers class? Do I want to go back to these classes where I'm around people and I could get sick? I just looked at the dial, our little dial that tells us how severe things are, and we're in the low yellow right now, which is very good, but we're still having cases. We still have cases. I can see the cases that are coming into the hospital, and they're not as severe as they were even a month ago, but we still have cases that come in. More people are being diagnosed with COVID, but they're dealing better with it. If you look at the number of people in Nebraska over 65 that are vaccinated, there are quite a few that are vaccinated and quite a few that have boosters. So this population takes it very, very seriously. However, they're concerned about going into public and being exposed even with the vaccination. They're worried about what's going to happen. So they're not going to get out and get into that group exercise again. They're not going to do something where they could put themselves at risk. So then, as Jean pointed out, they put themselves at a bigger risk for other health problems, such as falls.
Sure. And what's interesting is that it's kind of become a mental mindset now. How do I protect myself physically? How do I protect myself from getting these illnesses and maybe not being as aware of what they need to protect themselves in general health or whatever? And so we kind of need to shift our thinking a little bit to that. But financially, how are the elderly faring now? I think that during the COVID, people weren't really going anywhere or doing anything, but they weren't accessing services either. But financially, there's always, I think a lot of us have a concern for how the elderly are doing financially. Do we have any sense of that in our community?
The inflation right now is really taking its toll on people. Although they're getting a Social Security, a nice COLA, it's not nearly enough to make ends meet. And during the pandemic, people really had to pay for things they normally didn't pay for. They had to pay for delivery of items. They had to buy things they normally wouldn't buy. Like good quality masks were not inexpensive. They bought cleaning supplies they didn't do. And, when you're sitting around and you're bored, you've got nothing to do. If you've got a computer, you probably have an Amazon account. You might be doing a little extra shopping. So the pandemic, it really did have some unintended or unexpected detriments. That took its toll on people. I think with people with finances, one thing that we really saw an increase in is romance scams. Folks connecting online, and people were lonely and giving money to this young army man in Texas who's in love with me and he needs money. And people fell for that time and time again, and it still continues. It was just the perfect time for bad actors to get involved with older, lonely, isolated people.
Wow. Yeah, that's scary.
On the other side of it, one of the things that Jean's, all of the people that work with Jean at Aging Partners that we find so helpful is the fact that in order to help these people get not only their finances in control, but right now it's Medicare open enrollment in October. And so going to Aging Partners and asking for help to navigate that is so incredibly helpful. And they've got such good resources. And it's been so helpful for so many of my patients. They'll come to me and they'll say, which Medicare plan do I choose? And I scratch my head and say, I have no idea, but I know who does. And I direct to Jean and Aging Partners because they really help people navigate and find all those things that are going to be very important for the patient to know which prescription plan is going to be right, which Medicare Part B is right, what is right for the patient to fit into that financial need that the patient has, because their health care is so incredibly important. And so being able to look at that and understand it, there are very few people who understand it as well as they do at Aging Partners.
Thank you for that. Thank you for the referrals. We help a lot of people, and it's often not just picking a Part D plan. When you start talking with someone, you can find out there's a lot of other things going on. And we'll walk folks through all kinds of decision making.
That's critical. That's an incredible service. And that's really an important point to make, is that even though all of them are on Medicare, that doesn't necessarily mean that it's all the same for everyone. Right. And I think that there's a lot of sometimes some misunderstandings about what they have as coverage. So those services are really, really helpful. That's fantastic. Let's talk just a little bit about caregivers. You mentioned that at one time, and now where are we standing on caregiving? Do we feel like caregiving's coming back and it's back and strong? Are there still some concerns about caregivers and caregiving?
You go ahead, Stacy. I keep answering.
So I think it's a difficulty. Family members sometimes try to do this, and sometimes they try to hire caregivers. I think any of the agencies that do caregiving are having a revolving door with the people that work there. And it's not that they don't want to. It may be that they can't keep their employees. Now, this is an employee problem across the board. If you look at all sorts of different healthcare entities, you'll find that it's difficult to hire people and keep them working there. So I'm seeing this with caregivers as well. Agencies that provide caregiving really are having a difficult time to have enough employees to be able to provide those services. So when you're hiring someone to take care of your loved one, you're finding it hard to have that coverage full time. It's very difficult.
Jean, anything else on caregivers?
What family caregivers do for loved ones is tremendous. People work so hard to keep their loved ones at home. And so a lot of what Aging Partners does is we support caregivers and try to figure out how to keep them healthy along with their loved one. So we have a caregiver support group here. There's several caregiver support groups that meet throughout Lincoln, and we really try to connect people with one another.
I think that's really the key too, is that when we were talking about the COVID and what it meant to the elderly, that caregiver piece became such a critical issue. When some of them had a regular routine and had regular caregivers that they really depended on, and then that disappeared, that has to have made a lot of difference for their mental health as well as their physical health. And there are a lot of people that we've talked through the Women's Foundation and Women's Commission that were caring for the elderly, and they were really scared. And there's like, how do I take care of my children who are here from school, when they were out of school, and my elderly parents that are in the same space. And how do we navigate that? So I think that there really were some big concerns. And I do know what you're saying about employers having difficulty finding qualified people who are doing these jobs, but they are so vital. One thing that we would like to do at the end of this program is to put up a list of some resources. And I've asked Dr. Waldron and Ms. Holt to give us some resources that would be helpful so that those of you who are watching our program or listening to our program will be able to see a list of resources that can be helpful if you're trying to help someone either in your family or in your neighborhood or whatever. And these are going to be things that can be helpful for you as far as accessing services and what kinds of things are available in Lincoln. I would have to say that I do think that Lincoln has a lot of good services, and we are very fortunate to live in a city that has a very proactive administration that really does try to do as much as we can for all different ages of population. And certainly the elderly, we see them as a very valuable part of our community and a growing part of our community. And we're really very grateful to have all of these different services. Well, we've had a really good discussion today and we really appreciate it. Is there anything else that you'd like to say, just sort of to finish us off this today?
I'd like to give a quick plug to our Neighbor Link program. It started during the pandemic. They are Neighbor Link volunteers are screened individuals that it's a program run through Aging Partners where a Neighbor Link volunteer is assigned to an elderly person and they do grocery shopping for them, maybe run an errand or two, just to keep the older person safe and away from other people. But it's just kind of a friendly visitor. And the program has been so successful that even though the pandemic has died down, we continue to keep the program going because it's been a real treat for the volunteers and for the older person as well.
That's fantastic. And what is the name of that program again?
Neighbor Link.
Neighbor Link. Okay. And we'll put that resource up at the end of the program as well. Dr. Waldron, anything else that you would like to share?
And I just like to mention that sometimes when we're going through something like a pandemic or anything that's where we're finding we're a little down or sad, I know this time of year is when we start to feel that sad mood with the temperatures changing and the sun changing and things like that. But there are also times when sadness can mean something a little bit more than that. And it would be a really good benefit to us to bring that up to our primary care physician so that we could reach out and get the help that we need. And that's important no matter what our age is. It's always good to talk to someone who's a professional. Jean's a social worker, I'm a psychologist, and there are lots of professionals out there who are trained to talk to you and help you through those moments where you're feeling not yourself. So we're out there and we're ready to help. One of the links that I'm going to provide for you is a way that you can take a screening yourself to look at maybe there's a little bit more than just that blues from not having the sunshine in the summer here anymore that might be helpful.
Thank you.
Fantastic. Well, that's great. Thank you so much. Well, again, we want to thank Dr. Waldron and Ms. Holt for being with us today. Both of you have been so helpful, and we really want to encourage everyone to use the resources that are provided. If you are interested in learning more about women's health, please go to our website, which is lincolnwomen.org. We also have an email, which is lincolnwomen@gmail.com if you would like to contact either the Women's Foundation or the Commission on Women and Gender. We are very grateful to the foundation for paying for these programs, and we do hope that they serve a purpose in our community and letting information get out there to everyone. And feel free to give us some suggestions if you have them on what you would like to see as far as our programming is concerned. Again, my name is Kathy Ermacher, and I thank you for joining us today. And this has been Women's Health.